see an area where we need to work all together, and it was referred to this morning also, is in a lot of situations, healthcare systems and policymakers had to make a decision to prioritize COVID-19 patients, which meant then a deprioritization of other patients. And going forward, of course, this was a new situation for all of us, but going forward, I really hope that with all the stakeholders in the system, we can work together to build a robust system that can deal with patients affected through a pandemic or a crisis situation, as well as continuing the healthcare that we are bringing to for example, chronic patients, cancer patients, cardio patients. So for me, this would be the three areas where we need to work together and invest.
Thanks, and let me just also reflect on that. I think companies will find their way into this discussion based on perhaps where they focus on. I look at our colleagues at Novo Nordisk, who have done a great deal of work around outcomes in the diabetes area, and they've taken that down with a real dialogue around integrated care. If we look at the results of diabetes, when all of our diabetes care tends to be in centralized hospitals, sometimes those outcomes we have less positive outcomes, more amputations and those types of things than when diabetes care is actually in the community, very close to those that are challenged by that disease. If I look at BMS, my employer for the last 2 weeks now, we're very focused on cancer, and there's a very broad, not BMS initiative, but a very broad industry and stakeholder initiative called ALLCAN, ALL.CAN, and it's about building an understanding of how cancer care and cancer care pathways can be improved by looking and measuring outcomes. And those are the types of things where I think we're looking at how do we use real world data and real world evidence to try and inform those changes. I think, again, one of the benefits, if there is a silver lining in COVID-19, we have demonstrated that we have the capacity to do things differently because we didn't have a choice. We had to do that, or many people would have suffered significantly worse outcomes. And so we can change. And so now the challenge is, can we do that absent the crisis of a pandemic? And the answer to that is yes, we can. I think the open question is, will we?
Thanks. So looking at the time, and also looking at all the comments that we are receiving in the chat, and Doug, if you cannot look at us at the same time as the comments, I certainly I encourage you to read them afterwards, because it's really interesting input that we're getting via the chat. So we often talk about what the future should look like, and we have this visionary perspective when we are in a lot of policy discussions, but bringing it back to now and to the reality, what would be a good next step to take from your perspective? Where would you, if you were the decision maker, where would you basically invest first? Monica, I first go to you.
Difficult question. Thank you. First, I wanted very quickly to say that indeed we have quite really interesting comments, and I say hello to Vincent, where the comment passed already by, but so I invite everybody to read the comments, and I invite everybody to read the introduction of the report Science Business did about healthy measures and patient outcomes, because we had a look recently on that, and it merits to be read. Yeah, so to come back to your question, what would be the first or the next steps to be done? I was just taking some notes, and which are not directly answers to your question, but I want to say it in the minutes kept for us. First is that to measure outcomes, one thing we have to really work and invest in, and it's not so expensive, but it needs to be done, is to really explain to patients what it is about, because we need them. We talk about patient-centered. Some patients want to speak, but many patients don't even know that they could ask questions, speak, or tell what they feel or what they need to what they want to communicate. So there is a huge room of work to be done on this outcomes measurement with the patients. And we have seen some islands like Doug has been saying, where it functions, where the families are associated, and this gives really a positive impact on healing the people and overcoming the diseases. I don't know if within the COVID framework, hospitals had time to do that, unfortunately, possibly not. And a different topic I want to mention before time has passed is that we are talking about health systems, patient outcomes measurement, and so on. And we should look a bit beyond this limit of health, because the question I have been asking myself in these months of the epidemic is, why does this happen? And why didn't we in Europe wake up early enough? And there are many other questions which we are raising. And possibly we should ask ourselves a little bit more about, isn't there an impact of totally different scientific topics like biodiversity or climate who are having an impact on our immune systems? And I think there should be some money going on seeing how other fields have an impact on our health and the outcomes. So sorry, Elke, I know I'm not straightforward giving an answer of what you said, but I wanted to pass these messages in these last minutes.
And let me just build on what Monica said. Absolutely, education, change management, involvement and activation of patients is absolutely critical. If I look at it politically, what I would like to see are healthcare leaders, whether they're at a region level, a national level, or at a European level, is really to try and focus on prevention. Again, much of what we're doing is about treatment after something has happened. And I think Monica's talked about how when we look more broadly at biodiversity, a whole bunch of things, how do we prevent the next pandemic from happening? We probably can't prevent all pandemics from happening, but we can do a much better job than we have, and we have to learn from this experience and do a much better everywhere. We all know that borders don't stop pandemics and viruses. And I think that's a key takeaway from this for everybody. So we're all in this together. If we choose not to participate together, like some countries have around the world, then that's to the detriment, I think, of all of us. So I think we have to get back to a point where we have the trust and we have the ability to communicate across political differences, across geographies, and across oceans. And secondly, I think there's some work to be done. Again, if we're looking at the outcomes and we look at where we've had a disproportionate amount of COVID-19 deaths, it's really been in the in the social care setting. And when we look at the challenges that many countries have had of delivering even gloves and PPE equipment to workers, we haven't looked at healthcare and social care in an integrated enough fashion. And we have all these silos. So we create these silos, we create borders between countries. The virus ignores all of that. It doesn't matter that I'm a Canadian national, and if I go back to Canada, I can take the disease with me and impact my friends and family back there. So I don't go there, right? And so sometimes we get so stuck in our little silos, whether geographic or political or institutional, that I think we would do a good job if we learned that that the virus doesn't look at those things, and we should probably be less focused on those silos that we have.
Thanks a lot, Doug. And thanks a lot, Monica. Thanks for sharing your insights, your experience, and also your ideas. And also thank you to the many people in the chat that have engaged with us. I would like to take away from this discussion that certainly there is a lot of passion around this subject. And I often say also internally within the company that I believe that on this journey to transform systems towards outcomes based, we have managed to convince the brains of the technical experts. And Monica, you refer to it now, Science Business has come up with this Healthy Measures report, and I truly believe that all together as a well-educated community, we can now work together and also convince the minds of the political leaders that this is the way forward and that this is where we need to go. So with that, I would like to thank every one of you. It was nice to see you again. It was a long time ago, and I'm certainly looking forward to see and hear much more of you in the near future. Thanks a lot.
Let's do it.
Thanks,
you,
everybody.
Elke. Thank you, Doug, and thank you, everybody. Bye.
Bye-bye.